Hi, EJ. I'm Amanda. Thanks for coming to the Connecticut's Children's Medical Center. It's great to have you here.
Nice to meet you, Amanda. So I guess before we get started, I have my copy of a resume right here.
Okay, great. I'll definitely take a look at this later. So just to get started, I want you to just tell me a little bit about yourself.
Okay, so I'm a graduate of the Ithaca College Physical Therapy program. It's a doctorate program, it's a 6-year program. I received my bachelor's in clinical health studies.
Okay.
And I'm from Long Island, New York.
Awesome.
And I've been pretty actively interested in physical therapy for most of my life.
Okay, cool. All right, so can you tell me a little bit why you're interested in this position and what interests you most about the position?
Well, in terms of the health field, my dad's a respiratory therapist, so I've been surrounded by different types of healthcare my whole life. I know throughout high school I volunteered, spent numerous years volunteering in hospitals. I know, and specifically in the medical center, you deal a lot with neonatal care. And I know specifically, I know it's a little personal, but as a child, I was born as a premature in neonatal care and in the NICU. And when I saw that, it really hit close to home, and it really was something that attracted me to your center.
Thanks for sharing that. And just, coming off of that, can you share some strengths or weaknesses with me?
One of the strengths that I could think mostly about is during my time at undergraduate in Ithaca College as well, I spent a lot of time traveling and being a part of the MLK Scholar Program. And what I did, I know it doesn't have a direct correlation to physical therapy, but what traveling and my time there, it gave me a lot of time to do research on different communities all around the world in places like Ghana, Vietnam, and the research I did there focused a lot about healthcare systems and interacting with different groups and populations such as youth, such as geriatrics. So having a lot of variety in the population of patients I dealt with and how healthcare is different in each place, I think gave me a lot of diversity in how I view how to treat people.
That's wonderful. What about a weakness?
Weaknesses, I'm very hesitant in terms of my approach to things. I like to take my time. I know that sometimes it's so meticulous that it could kind of hurt me in the end, that I'm too hesitant, and when I want to go for something that it could also just stop me. And I think part of that is me trying to always make sure that I'm doing things at the best that I possibly can, but sometimes it's a fine line of efficiency and hesitancy.
Slow and steady wins the race sometimes, though, right?
Hope so, yeah.
So where do you see yourself in 3 to 5 years?
In 5 years, I see myself hopefully working here, continuing to work here. And one of the things I pride myself on is continuing my learning experience and continuing my education. So if I were to work here, trying to find programs of continuing education that could basically keep my knowledge growing and to keep my profession growing.
That's great. All right, so my next question for you is if you could tell me about a challenging situation with a patient or a staff member in a past experience that you were able to work through or overcome.
One experience that comes to mind is during my first clinical as a student in the physical therapy program in Ithaca College was I dealt with a patient who, for my initial evaluation, was in a lot of pain and a lot of discomfort. And I remember as a student, you wanted to make sure you were able to cover all bases of getting all the objective measures in, doing all the goniometry measurements. But I noticed that during those, when I was performing the goniometry, that the patient was just in so much discomfort that at the time it just called right to stop the objective portion of the evaluation and just to start sort of treatment, and not in the sense that we're going to start an intensive plan of care immediately, but sort of kind of catering to the patient and knowing that their care comes first. So I think it helped me realize that you don't always have to do things by the book, and you always, for the most part, you have to respond first to your patient. That's really what matters.
That's great. All right. Are there any particular types of patients that you like to work with?
In particular, I guess, for your center, working with youth athletes is something that interests me a lot. I know as a child I was always interested in always playing sports, really active. But at the same time, I always like to work with a variety of patients too. Like I said, I think my experiences traveling helped me get a different feel for a lot of different groups of people, a lot of different personalities. So having a variety is good too.
That's great. All right, and then just to finish, do you have any questions for me?
I guess any questions in particular is, I know you have a department under the center called Elite Sports Medicine.
Yeah.
And I just wanted to know any specific specializations, any specific treatments and methods that you all use.
So our sports physical therapists, they're specially trained in specific rehab techniques, and they include Graston, the prolotherapy, post-concussion return to sport, and stretch. So you have a whole variety within the sports population that we deal with. It's pretty cool.
Very good.
Anything else?
One more question.
Okay.
Sorry about that.
No, not at all.
I know in the outpatient physical therapy portion of your center that you have services that are known as power mobility and evaluation training. And I just wanted to know a little bit more about the details of those services and what they provide.
Right. So the power mobility is specific to children with ambulation impairment. So this would be a child that's a candidate for a powered wheelchair. So we'd assess their gait, their impairments, their deficits, and see if they'd be a likely candidate for that for the power mobility. And then what we do to work with them is actually train them on how to navigate and use that powered wheelchair. So it's a great way for children, to actually be able to explore just like they would be without the impairment. So it's a great setting if you'd like to get involved in that.
Thank you. Sounds like a great facility.
Yeah, so it's great to have you. Thank you
Nice
so
meeting you
much.
too. And before I leave, do you mind if I could take a business card?
Absolutely. Well, I'll grab you one on the way out.
Thank you.
Okay.